afternoon, everyone. Today I'm wearing a Middletown Middies mask given to me today in Middletown by Superintendent Marlon Stiles and Principal Beth Hendricks. Lieutenant Governor and I were there at Amanda Elementary School where I signed House Bill 2. House Bill 2 creates the Ohio Residential Broadband Expansion Grant Program and the Broadband Expansion Program Authority. This will enable us to award grants to internet providers to fund the construction of broadband projects in underserved areas of the state and unserved areas of the state. So we're very excited about this, and this was really a big kickoff to this big program. And our goal is for every single Ohioan to have access to high-speed internet. And that's our goal, and we're working on it. With the FDA approving the Pfizer vaccine for 12 to 15-year-olds, we want to hear from some doctors who also happen to be mothers. And we asked them about the safety and effectiveness of the vaccine. And we recorded new radio PSAs featuring several of these doctors and some of their children, and talking about why their children got vaccinated. So let's listen to what they have to say.
COVID-19 can absolutely affect children. Sometimes side effects that we'll see later with kids, where there's inflammatory responses in the vascular system. I was vaccinated in the first group, and Jaden was just vaccinated. Do you remember how you told me to get the vaccine? I just encouraged you, just like I always do. It was just another way of protection for our entire family. I can't even describe when I saw my children after being fully vaccinated and how done just without the fear that I'm going to make them sick or get sick myself. As a mother and a physician, I trust giving this vaccine to my family. The science behind these vaccines is not new. It's been going on for years. I know that these vaccines are safe and effective. I love my daughter and my family, and I would do nothing from her. Oh. This is brought to you by Ohio Department of Health.
Well, we got one in. I think there's another one, but we'll go with that one. We want to thank the mothers, doctors, and their children who were on that PSA. We appreciate that very much. This weekend, Fran and I visited Young's Jersey Dairy to see the Clark County Health Department doing some vaccinations, and they were doing a great job. Young's was giving away ice cream cone for anybody who got the vaccination. It's always a very, very friendly place, and Clark County does a really, really nice job. Also, two of our grandchildren, Josie and Rebecca, got vaccinated there as well. So it was a good day. On Friday, I announced Ohio will be amending our remaining health orders to conform to the new CDC guidance, which says that those who have been vaccinated no longer need to wear a mask, while those who have not been vaccinated should still wear a mask and socially distance. And I think to understand the CDC's, what they have said is just that fundamental distinction now between those who have been vaccinated and those who have not been vaccinated, and what each group really safely should be able to do. CDC still recommends everyone wear a mask when they're in a healthcare setting. Everyone should do that. Also, when they're traveling on public transportation, and that would include airplanes, and when they're in a business or employer that chooses to require masks. So everyone should wear a mask then. Our order will be amended to reflect these recommendations as well. That order will be issued later this afternoon if it's not already been put out. Our order will continue to require masking in congregate settings, such as nursing homes and assisted living facilities, and settings with large numbers of unvaccinated individuals, and that would include schools and daycare centers. Again, this is in line with the new CDC recommendations. The CDC recommendations made it clear that businesses will be able to choose for themselves whether they continue to require masks in their premises. We understand a business certainly has no way to check vaccination status. If a business chooses to require masking for the employees and customers, that is permitted under the CDC guidance, and it is permitted under our order. If a business chooses not to require masks and leave that choice to customers and to employees, that is also in line with the CDC guidance and also in line with our health order. All individuals who are not vaccinated, again, according to the CDC, are strongly encouraged to get the vaccine and to continue wearing a mask until they do under the CDC guidance. A couple other points just to emphasize again. I got text from a school superintendent this weekend. I want to be very clear. So we're asking the schools to continue to mask, continued as they have been doing. They've done a phenomenal job. Students have done a great job. We've kept spread in the classroom to virtually nothing. And that's a tribute to the administrators, teachers, and to the students. We want that to continue on. Also, all health orders, as we have previously announced, will come off on June 2nd. So that is, people get up June 2nd, then these health orders are in fact off. So at that point, if there's some schools still in session, then that will be up to that local school what they do in regard to masking. But most schools are finishing up. But if a school would decide to change their policy on June 2nd, they could do that. Now that 12-year-olds and up can be vaccinated, we know that parents and guardians and young people may have questions about COVID-19. The Ohio Department of Health has prepared an additional set of frequently asked questions and answers for their website that addresses some common questions for those under the age of 18. The document shares information about parental consent, about accompanying a child to their appointment, and where children could be vaccinated. It's all there. Children under 18 who are not emancipated must have parental or legal guardian consent for any vaccine. Also, the document discusses the safety and the effectiveness of the vaccine for children. It's available at coronavirus.ohio.gov. That's coronavirus.ohio.gov. Just like adults, youth can be vaccinated at many different locations across the state. We would just remind you that Pfizer is the vaccine that is available for children 12 and above. You can find that many, many, many places. We have over 1,900 locations. Many of them have Pfizer. It's available at our children's hospitals. It's available at a number of our regular hospitals, general hospitals. It's available in many health departments, many retail pharmacies, community health centers, and let me also comment about primary care physicians. We know that some people have told us that they are used to going to their primary care physician, used to going to their pediatrician's office. And so let me talk a little bit about that now. We are making this available to any pediatrician's office that wants the vaccine. So we would encourage them to contact us. Again, it's available other places, but if you want to go to your pediatrician, call your pediatrician first to see whether or not they do, in fact, have it. Again, we will make that available. We've done it to pediatricians' offices who want it. If more want it, we're happy to make that available to them, and we will, in fact, do that. We encourage pediatricians' offices to sign up to be a COVID-19 vaccine provider. Vaccine manufacturers and health authorities have relaxed some of the guidelines from the initial approvals, making it easier to store the vaccine in the office. As many of us will recall, originally Pfizer needed ultra cold storage. Now it does not. Pediatricians and other potential vaccine providers can find more information at odh.ohio.gov. That's odh.ohio.gov. Also would again say children's hospitals are another place where you can get the vaccine. Today, we're reporting 729 new cases. We're happy to see the number that low. We are continuing to closely monitor our 2-week number of cases per 100,000. Today, that number, as of today, has dropped to 106.9. That is 106.9. That is a drop of 13 points since last Thursday. So we've been running 2 to 3 point drop. We've been dropping 15 to 20 points every week since mid-April, which means that we are on track to hit our goal of 50 cases per 100,000. We would think during the coming month if this continues. So we don't know if it'll continue, but we certainly like what we're seeing in the numbers and numbers coming down. And of course, that is caused by more and more Ohioans getting vaccinated and more Ohioans then over the next few weeks after that first shot getting that immunity. Earlier today, the Ohio Department of Health Director, Stephanie McLeod, and the Director of the Ohio Lottery, Pat McDonald, held a press conference to discuss the specific rules, terms, conditions of our new Vax-A-Million drawings. Just to recap very quickly, beginning May 26th, we will announce 5 weekly winners of a drawing for $1 million. All Ohioans 18 years of age and older are eligible. They have to have been vaccinated. Those who have been vaccinated are eligible. Also beginning May 26th, we'll announce 5 weekly winners of a separate drawing for a 4-year full-ride scholarship at one of our state universities. That includes room, board, tuition, books. That is for those between the age of 12 and 17. Now, we announced at 11 o'clock today one notable change to the design of the Vax-A-Million drawing announced Wednesday. Ohio Vax-A-Million will now be an opt-in. You have to opt in. So starting tomorrow, 8 o'clock, I believe is the time, Ohioans will be asked, if you have been vaccinated, be asked to register for the drawings by visiting ohiovaxamillion.com. That's ohiovaxamillion.com, or you can call the Ohio Department of Health call center, and that number is 1-833-4-ASK-ODH. That's 1-833-4-ASK-ODH. Registration will take place. So again, 2 things that you need to do. One is get vaccinated. The other is to go online and register, or you can do that by telephone. Either way, and get registered and get into the system. Once you're in, you're in. So you do not have to re-register every week. Again, the way to register is visiting ohiovaxamillion.com or by calling the Ohio Department of Health call center 1-833-4-ASK-ODH. Since we had 2 big announcements last week, of course. One was moving to the 12 to 15-year-olds and adding them to the people who could be vaccinated. We're very happy about that. We also announced our Vax-A-Million initiative, and we're getting anecdotal reports back from health departments that we're seeing an increase. We had been seeing a downturn that continued, fewer and fewer people getting vaccinated. It would appear at least that we have bottomed out on that, and there's some indication that we're certainly seeing an increase. Just as an example, last Friday, May 14th, was the highest day of shots administered in the last 3 weeks. That would be since April 23rd. So from April 23rd, if you take today, or take Friday, the 14th, and that's the day that we have most of the vaccinations actually filled in. It takes several days to fill in. So May 14th, highest date of shots administered in the last 3 weeks. During the 3-week time period I just outlined, Ohioans aged 30 to 74 were experiencing a 24% decrease week over week for those prior to Friday. So we were going down. Last week, that age group saw a 6% increase. So we think this is good news. Good news not only for our 12 to 15-year-olds, but good news in regard to our older Ohioans as well. We'll stay tuned, but this is the way we get out of this pandemic. More and more Ohioans becoming vaccinated. Our cases are going down, and that is in inverse relationship to how many people were getting vaccinated. So that is very, very, very good news. Lieutenant Governor, we'll turn it over to you.
Thank you, Governor. I just have one quick update, and As our attendees will recall, as a result of the wide availability of both jobs and vaccines, last week we announced that there's going to be a reinstatement of the work search requirement under the unemployment compensation program, and that will be effective on May the 23rd. And we received some calls from employers who want to know how they do that. How do they report somebody that won't return to work? Many of them found it difficult in the past and really hard to find. And so we pride ourselves on improving our technology and our access and our customer service. And so what you will see, and I think we'll go to these slides, that there are a number of ways in which employers can report non-compliance with the new rule at jfs.ohio.gov, unemployment.ohio.gov, and ohiomeansjobs.com. When you click any of these, you'll be directed to the eligibility notice refusal to work form. This is compliant with Ohio law, under Ohio law, which is the standard that we're reverting back to. If you do not have access to these resources through a computer, you can also call 1-877-644-6562. But we recommend that you use the tabs on these websites. We've made it easy to use so that people have the ability to comply with the rules as it relates to unemployment compensation. Just worth noting that right now we're creating jobs faster than employers are finding people to fill them. The unemployment rate has returned essentially to pre-pandemic levels, but there are also we want to emphasize this, the number of education and training programs that can help prepare individuals for the jobs that are being created out there. Individuals can visit ohiomeansjobs.com or contact their local Ohio Means Jobs Center to find and apply for job openings. ohiomeansjobs.com currently lists more than 180,000 job openings, and nearly 95,000 of those pay $50,000 a year or more, which is at around an all-time high for that number of jobs that pay those wages. And we have a variety of resources for you to get trained if you're trying to do a career switch. Because remember, education and job training qualifies as a work search requirement. So you can get yourself prepared for a new career and still meet that work search requirement. To find more contact information, to helpful resources, go to the Ohio Means Jobs Center near you or ohiomeansjobs.com and select Find a Job Center as a resource to have a physical location in your area, or you can call the number at the bottom of that page, which is 888-296-7541. So what we're doing is we're giving you an easy to use tool as an employer to report somebody who you've offered a job to or who will not return to work as part of that requirement. And we're also making it easy for the person who's out of work to become that potential employee, to get the job training and the resources they need to move back into work. So it's just more, as we hear, Governor, from people who are trying to navigate the system, we're trying to knock down those barriers and make it easier for them to do it. And we hope as more and more people are stepping up, getting vaccinated, and employers are creating jobs, we'll get this economy moving even faster than it is already, and continue to grow opportunities for people across the state. Thanks, Governor.
We're ready for questions.
Governor, first question today is from Jess Hardin at mahoningmatters.com.
Jess.
Hi, Governor. Thanks for taking our questions today. I was speaking with some local school administrators last week about low vaccination turnout at school clinics. And the administrator said that they weren't really encouraging students to take the vaccine because they didn't want to make a political statement or kind of wade into that argument. Are you encouraging school administrators to, do a better job of messaging vaccination opportunities for students?
Well, I don't think it's political. This is not a political issue. But I think ultimately that decision is a decision for the parents and for that child. I think schools, we appreciate when they make it available, but ultimately that decision rests with the parents and with the child.
Next question is from Brian Somerville at WBNS in Columbus.
Hey, Governor, thank you so much for taking the time. A couple of really quick ones. First of all, I just want to make sure I heard you clearly that it is only a recommendation from the state for districts to continue to wear masks while in schools. Just want to make sure I heard that right. And then second of all, as these orders are lifted, you said earlier that it may be difficult to really prove who is vaccinated and who's not. I think you talked about this earlier. We are truly on the honor system here. Does that give you any pause for concern as we move forward with going about life again unmasked?
Yeah, if I said that about schools, I misspoke. Schools, the health order extends to June 2nd. And so we want the schools to finish out the school year just like they started. And that is to have everyone have a mask on. It has worked exceedingly well. It's been one of the most successful things that has happened. We've been able to keep spread out of the classroom. Now we've had, kids bring it in from outside, but when kids are in a classroom, they just don't spread it. So we would like for them to finish up, but June 2nd is the day when you get up, the health orders are off. And so if a school wants to make a decision, that late in the year to switch over and not have mandatory masks, they can do that. But up until then, schools need to, and the health order says that they will have to continue to mask. Second question, I'm sorry. Go ahead.
I was wondering, as these orders are lifted, does that give you any pause for concern, knowing that some people may try to use this as a time, even unvaccinated, to take the mask down in public?
Yeah, I think that, we really do have two groups of people. And the people who have been vaccinated can feel safe. They might want to find circumstances where they feel more comfortable wearing a mask, and we should respect that. We should respect it if they don't want to wear it. As far as those individuals who are not vaccinated, they're taking a very significant risk. But ultimately, 14 months into this has to come down to individual choice. And, that's why we made the decision to take the health orders off on June 2nd. And, people can protect themselves now and have the vaccine and have the ability to do it. What I said was, no one can really tell. What I simply meant is that, as far as a business, they really have to decide, are they going to continue to follow a protocol that they have every right to set? And that is, if you come in my business, you're masked, or they can make a decision not to be masked. I think it's tough for them. They can do whatever they want, but I think it's tough for them to enforce a rule that said vaccinated people don't have to wear a mask when they come in my store, but unvaccinated do. I just think that's mechanically difficult. It's practically difficult for them to do.
Next question is from Courtney Wheaton at WKEF in Dayton.
Hi, Governor. I was just wondering, with those people that aren't wearing the mask and just new variants and the future, if we saw those numbers rise again, could we ever have restrictions again, or are you kind of just moving in a different direction at this point?
Well, that would be something that we would have a discussion with the General Assembly about. As you know, they passed a bill in regard to health orders. So if you look to the future, that would be pursuant to the law as written in that bill, which takes place and comes into effect, I think, June 23rd. So I think that, what we hope and what we see is that the vaccines are just amazingly work well, and they just are very, very effective. And that if you've been vaccinated and that time has elapsed, that 2 weeks after your last shot has elapsed, 2 weeks or so, you are very, very safe as you go about. And I think people should have confidence in that. What will happen with the variant? I mean, I described it from this podium, a few weeks ago as a race. And it's a race between the new variant and how many people can get vaccinated. Now, we are starting to win that race because we're seeing cases go down, and they're going down because of the number of us that are getting vaccinated. But, we just need all of us to continue to encourage everyone to get vaccinated, because that is how we make sure that we don't have to address those tough issues again. If a variant rears its ugly head up, and then we have to make very, very tough, difficult decisions, no one wants to see us go back. I was down at, a friend and I were see the new soccer stadium in Cincinnati, a phenomenal place, but you just walked around there and you talked to people, and they were just so happy to be vaccinated. They would tell you that I'm vaccinated, I feel good, I'm getting out, I can come here today, I can do different things. So the whole game today is now on vaccination. That's what we have to focus on. And that's why we're doing absolutely everything we can think of to encourage more people to become vaccinated while respecting their right not to be vaccinated.
Next question is from Jim Otti at WHIO in Dayton.
Hey, Jim.
Governor, on behalf of the schools in the Miami Valley, I wanted to ask and get some clarity here. If they have a program that extends well past June 2nd, is this like a light switch? In terms of your health order, is it like a light switch? And June 1st, they are going to be required to wear a mask in their classroom. If they have summer school or extended learning starting the morning of June 2nd, that school district could, in fact, elect to have a mask off. Is that correct? And what would you tell them? Do you have a lingering recommendation for them beyond the health order?
Well, Jim, on June 2nd, schools, if they're still in session, will have the option not to require mask. My recommendation would be that they continue that policy of masking until school is out. It has worked exceedingly well. We've seen, precious little spread in the classroom, and the reason is because kids have done a great job. The administrators, the teachers, everyone has done a great job. So look, I would recommend they finish out this school year with mask on, and I think that's the right thing to do. But if that's a decision that the school will make, and so that school can make a different decision if they want beginning on June 2nd. They will have the ability to say, you don't have to wear a mask anymore, or they'll have the ability to say, we're going to just continue on the policy throughout the remainder of this school year wearing masks.
Next question is from Danny Eldridge at Hannah News Service.
Hello, Governor.
Danny.
My question is, so are schools and universities and businesses able to require the vaccine for employees or for students, or does the FDA need to fully authorize it first? Can you just talk about that a little bit and how that process could work here in the coming months?
Yeah, I'm not their lawyer, and I'm not trying to be cute here, but they need to talk to their lawyer about that. My understanding is that they have the right to do that. You're seeing some of the national chains, for example, that are requiring anybody that works there and anybody that comes into their retail establishment to wear masks. It is my understanding that they have the legal right to do that.
Next question is from Jim Province at the Toledo Blade.
Hey, Jim.
Governor. You walked in today wearing a mask. Is there anything that you have changed in your personal practices involving face masks and social distancing since you changed the orders for the vaccinated? And is there any chance that we're going to be returning to in-person press conferences before too long?
Yeah, I think we will be returning to in-person press conferences at some point. There is one advantage of this, doing it the way we're doing it now, and that is that we have people who are all over the state who have the ability to get on there. But I see no reason that we will not go to in-person press conferences. As you know, we've done some version of that as we've traveled. We were at the Cintas Center. We did that. We were at the Wolstein Center in Cleveland. We had press there. Today in Middletown, the press conference that John and I did, which was actually a bill signing, we had press there as well. So sure, there's certainly at some point we'll go back to in person. But I think having people's ability to call in is also probably helpful as well. As far as what I do or Fran I do, I don't know that we've changed dramatically. This is kind of a transition period of time. I think for people as they try to figure out, okay, how do I want to do things? When we were yesterday, for example, when we were around children who had not been vaccinated, they had masks on. Some parents asked me to have a picture taken with them, and I kept my mask on. They had their mask on, so I kept my mask on. I just think you have to take it case by case. I feel very confident in having the vaccine. Fran feels confident in having the vaccine. We have been, once we got vaccinated, we've been able to, hold our grandchildren, six 6-month-old babies down the road from us. And so, we have changed in what we do. But going in and out, for example, the stadium yesterday, I wore a mask going in, I wore a mask going out. And, for part of the time, watching the match, I, had a mask on. Part of the time I didn't.
Next question is from Jackie Borchard at the Cincinnati Enquirer.
Good afternoon, Governor. I want to ask a question about the incidence rate, the 50 new cases per 100,000 residents. You and Dr. Vanderhoff have put a lot of stock into that metric as a really strong guide for lifting the health orders. So I'm wondering, why did you stop using it to determine when we would lift the orders? And was it not the right metric?
Well, I think it's a good metric. And the interesting thing is, Jackie, I can't predict the future, but I can do the math. And if we stay at, three going down 3 points a day, we're going to hit that number about the time that the orders come off on June 2nd. Now, I don't know if that's going to happen or not, but we're on track. We're on track to do that. I have always felt, when we talked about should you have case metric or should you have number of vaccination metric, I've always felt that they were directly related to each other. And we felt confident, Dr. Vanderhoff felt confident that 50 was a good number. And we checked with some other epidemiologists and they agreed as well. But we always felt that if we hit the 50, it also meant that our vaccinations were going to continue to have gone up. So no, I don't think those are wrong. We made a decision, frankly, to give a date certain to the people of Ohio, because after 14 months, it's time to transfer that responsibility over to individuals and let them make their own decisions. We now have as much vaccine, as we need. Anybody can get the vaccine that wants it, unless they have some medical reason they can't get it. So the vast majority of Ohioans can get it. It's a free choice. They make that decision. We set the date further enough in advance to give people warning. Hey, these are going to come off on June 2nd, and you'll have the opportunity between now and then. If you've not been vaccinated, go out. You still have the opportunity to get vaccinated. So that's how we did it. I don't know whether Dr. Vanderhoff is on here or not. We can go to Dr. Vanderhoff and see if he has anything to add to that, because he worked on that 50 number.
Thank you, Governor. You summarized it, I think, incredibly well. As we were looking at what would be a threshold, a number that would indicate that not only were we beating the virus, but we were doing so in a sustained way that would avoid a rebound, that would avoid a situation where there was a high likelihood of seeing things go in the wrong direction. And particularly challenging, of course, is the impact of the variants and the fact that they changed the game in terms of infectiousness. But 50 really seemed to be that number. And as the governor said, it's really rather remarkable. We are tracking to be right on target, to be very close, to be certainly in the neighborhood of 50. Around the time that it just feels like the most appropriate thing to do to transition to our reliance and our focus on these wonderful vaccines.
Next question is from Andy Chow at Ohio Public Radio and Television.
Hi, Governor.
Andy?
I was wondering, from what I can tell, this new health order when it comes to following CDC guidance on people who are vaccinated en masse, it seems like this might be one of the first health orders to sort of make the difference between people who are vaccinated compared to people who are not vaccinated. How will the state order sort of handle enforcing how the mask order can be enforced when you don't really know who is and is not vaccinated when they go in somewhere?
That's a good question. And Andy, we were faced with the reality that we don't want to be confusing to the people of the state. So when the CDC came up with what they said, there was a lot of confusion out there. So Andy, what we've tried to do is conform our orders and understanding that our orders are only going to be in effect until the end of June 1, June 2 beginning, no orders. We wanted to conform them as closely as we could so that people would have one guidance to follow. It's not fair to the people of Ohio to have two guidances to follow. So we are in this transition period, not much longer until June 2nd. And, for example, in answer to your question, we're not going to enforce these rules as far as masking in a retail establishment. Up until now, one of the things that we've done is we've had inspectors go out, and they've done a good job, and the people have done a phenomenal job. I think the last I looked, we were at about 89% compliance in retail. But once this CDC new guidance came out, the signal to everybody was, you can take your mask off. And so we don't want to be in a position where we're telling people in the state of Ohio one thing, they're hearing something else from the federal government. We're trying to align those two, and that's what we're doing. Now, I just will take this opportunity to add, I think, one of the challenges of their order or their clarification when the CDC came out is I think some people are interpreting it, hey, there's no medical reason, no health reason for me to wear a mask. I'm unvaccinated and there's no medical reason. That is just the opposite of what the CDC is actually saying. So if you drill down at the science behind what they are saying, we have all indication that they're spot on, that they are making a very distinction between the vaccinated and the unvaccinated about what's safe for one and what is safe for the other. But we were just trying to clarify this.
And just a quick follow-up. Are you saying that the BWC is not doing that mask compliance investigation anymore? Okay.
That's correct. Between now and the end of the health orders on the night of June 1, we see no reason to have this group out because it's going to be impossible. It's going to be impossible for them to determine who's vaccinated and who is not vaccinated. And that's the problem that businesses face. Now, businesses, though, can make a decision. Without any health order, they can make a decision to require everybody to be masked. And some have done that. And you'll see other ones. Walmart, for example, made the decision, no, we're not going to, you don't have to be masked anymore. So you're going to see businesses make those decisions. we're requiring schools to continue to be masked through June 1. I suspect that all health institutions are going to continue to require masks. So, that's kind of the way this thing is playing out. But again, fundamental difference. What the CDC says, while their guidance has caused some confusion, the underlying medical advice that they're giving makes eminent sense from everything that we can read and see, and that is there's a fundamental difference between your safety level if you're unvaccinated and your safety level if you're vaccinated. If you're vaccinated, you're safe. If you're unvaccinated, you're generally not safe unless you're certainly wearing a mask and being very careful.
Next question from Ryan Hancock at cleveland.com.
Governor, I'm asking about the canceling the pandemic unemployment benefits. Do you have any data showing that people are choosing to stay home because they can earn more on unemployment versus working? Do you know how many Ohioans can't work because as soon as their child shows the slightest sign of illness, they get sent home from work or daycare? Also, what about this larger argument that jobs have substandard pay despite these increases we've seen in worker productivity and corporate profits?
Okay, I'm sorry, Laura, I completely missed your last question. I just couldn't understand that. I'm sorry.
What about this argument that we're seeing that jobs are paying substandard? We've seen increases in worker productivity. We've seen increases in corporate profits. Real wages, especially on the lower end, haven't increased. And so maybe that's why that's why they're staying home to get their unemployment.
Laura, we've been in this pandemic, for 14 months. Our unemployment now is down to what it was before we started the pandemic. We are moving forward as a state. We still have unemployment. We're still paying unemployment. We're just not paying just in another 30 or so days. We're still paying it now, but another 30 or so days, we will no longer pay the extra federal that is coming into the state, but we'll continue to pay unemployment. And the thing I would emphasize is if you look at how we do unemployment, we are very focused on getting that person back to work and giving them the skill sets, giving them whatever they need so that they have the ability to do that. That is really the most important thing. But it's time to get back to where we were before. And we hear it as far as data. No, I don't have any empirical study that has been done on it. But if you look around the state of Ohio, you're going to see a lot of businesses that only have drive-throughs now. You try to go in the door and you can't get in there, and then you talk to the manager and you say, what's going on? I can't staff it. So these are all business decisions that are being made. And it's one thing if that's taking place in a normal market, but when you have the federal government and the state government by passing the money on, distorting the market, it's not the best way that we're going to move forward as a state. Lieutenant Governor?
Yeah, thanks, Governor. Laura, to this point, we have been talking about for the past 14 months, literally from the beginning of the pandemic, about all of the resources we have available to help people get trained for the jobs that are out there that are high-paying jobs. This administration has made job training for everyone, whether you're in high school, whether you're in the workplace, whether you're out of work, a priority. From the programs that we created called, Tech Cred and the IMAP program, those are available for anyone in Ohio to earn an industry credential, and essentially we'll pay for it, courtesy of the taxpayers of the state of Ohio. Working with Jobs Ohio, there's a great program in Cleveland called Cleveland to Work. It's affiliated with Ohio to Work, where we are helping people overcome the issues of transitioning from the jobs that maybe existed pre-pandemic to the jobs that exist now. That's working very well at helping people overcome not just the job training issues, but things like childcare, transportation, and the like. But all this is reverting back to the traditional rules under which unemployment operated. It's perfectly appropriate given that the unemployment rate is essentially back to where it was pre-pandemic. Emphasizing again, nearly 95,000 jobs that pay over $50,000 a year alone are available at ohiomeansjobs.com. We are seeing wage rates increase even at the low end of the economic scale. And so we're working very hard to build that partnership between removing the disincentives to work, getting incentives to work, and then helping people have access to knock down any barrier or get access to the job training they need, because this is going to accrue. I'll emphasize this. Employers are expanding. They're making capital investments. They're picking the states and the communities that they want to invest. And if we have a robust ability to provide a talented workforce, this is going to accrue for a long period of time for the state of Ohio and its people. And we are beginning that recovery. We're in the midst of that recovery, and getting more people back to work will only hasten and enhance that growth that benefits everyone.
Next question is from Jeff Reddick at WSYX in Columbus.
Good afternoon, Governor. I'm sure you've heard a lot of the arguments against the Vaccimillion program. I wondered if you would address the argument from the standpoint of ADA Title II, the requirement for state and local government to give equal opportunity for those with disabilities to benefit from all their program services and activities. Do you have a reason why Vaccimillion is compliant, even though it requires vaccination, and some people cannot get that?
Well, I'm not going to be the lawyer. I've not done the research. We believe it is. But let me just, cut to the quick on this. We start with this belief, and it's not just a belief. We believe we start with this fact. We come out of this pandemic by getting more and more people vaccinated. That is our ticket out. It's our ticket to save lives. It's our ticket to keep people out of the hospital. It's our ticket to grow our economy. It's our ticket to get people jobs. There is nothing more important that we can do at this point than to get people vaccinated. We are doing everything that we can, from PSAs on radio, on TV, local health departments, local mayors, local county commissioners, all working every single day to make the vaccine available. And what we have done is not perfect, but we started with 650 locations. We're up to 1,900 now. We're literally seeing in some communities health departments going out and knocking on doors. We're taking it to everybody that we can. So when I kept asking myself, what else can I do? What else can we do as a state? Because it is so essential to our future. It's so essential to what happens in the next month, 2 months, 3 months, 4 months. How do we get more people? I felt that spending this money and setting this system up where we will say that we're going to have a drawing and bring some excitement about getting vaccinated, that if we could increase our vaccinations, that it would be worth doing that. We would save lives. We would help Ohio move forward. And every single Ohioan has a stake in getting more people vaccinated, because the more people we have vaccinated, the less this virus can spread, and that is in the best interest of every single Ohioan. So that's why we're doing it. It's one more thing that we think, very well could make. We believe it will make a difference, and not to do it after having looked at it and analyzing it and thinking, hey, it's going to make a difference. I think, that would not be good. We should do everything that we can while respecting people's right not to be vaccinated. But we also know that our future and our immediate future depends on how many people get vaccinated.
Next question is from Josh Rutenberg at Spectrum News.
Good afternoon, Governor.
Josh.
It was mentioned earlier that you had moved off that 50 per 100,000 metric. And I know that you've said that the vaccine and the pandemic is not necessarily a political issue. but it's certainly been politicized across the state, across the country, across the world. You've received some pretty harsh criticism from folks in your own party and across the aisle when it comes to the lottery, when it comes to your health orders ending. Are you afraid that any of this and your handling of the pandemic is going to cost you down the road as far as reelection is concerned?
Look, I can't worry about that. If I worried about, politics, reelection during this pandemic, that would be the wrong thing. My job is to do my job the best that I can, every single day, and to focus on what I think will make a difference. So, did I expect there to be criticism of this drawing that we're doing? Sure, it's not been done before. It's unusual, but these are unusual times. These are unusual times. I think we have to be bold, and I think we have to do everything within our power to get rid of this pandemic, and drive it to the ground. And getting more people vaccinated will do that. We know that. And so for me to look around and say, hey, there's a tool out there I might be able to use, and this we think this will make a difference, and then to turn away from it and say, oh, no, you can't do that because, there'll be people criticize you. I've had people criticize me for 14 months. It's okay.
Next question is from Adrian Robbins at WCMH in Columbus.
Governor, my question is for you or Dr. Vanderhoff, if he's still on the call. On June 2nd, when the mask order does go away, the CDC's recommendations will still be that those who are unvaccinated wear a mask, especially indoors. What is the level of mask wearing that you expect or hope to see here in Ohio when it is left to personal choice and responsibility and not necessarily a statewide order?
I don't know. I don't think anybody knows. It does come back to the individual. And, I don't want to presume to guess what number of people will do that. I do know that some people who have been against mask wearing are also, people who, are not going to get vaccinated, but that's not always true. We have people who, are on one side and they have not worn a mask, but they've been very, excited about getting vaccinated. So the answer is, I don't know. I don't think anybody really can predict what will happen. It just, with this vaccine being available for some time and now available for virtually everybody in the state to get it, it's just time. It's just time. People need to make up their own minds and their own decisions.
Governor, next question is the last question today, and it belongs to John London of WLWT in Cincinnati.
Hey, John.
Hi, Governor. I'm always interested in the genesis of an idea. You've talked a little bit about it, but what other things were you considering with regard to Vax-A-Million? What was it that you finally landed on that as the solution? And will there be a penalty involved if someone unvaccinated claims to be vaccinated and wins, since we're talking about a chance at big money?
Yeah, I don't think there'll be any penalty, John. We're not interested in penalties. We're interested in incentivizing people, giving them kind of one more fun reason to be vaccinated. Look, try to think of things every day. I mean, I was on the phone this morning with 7:30, 8 o'clock with all the health commissioners around the state of Ohio, and I always ask them, what else can we do? What are the things that we can do? I just felt that this was one thing that had not been tried, one thing that, there is certainly evidence that it motivates people. I mean, if you want to think about it, think about the pictures, what occurs when you have the multi-state drawings, and when the numbers keep going up and up and up and up of what they're worth. And then you see on TV, you all report, lines of people lined up to buy a ticket. So I'm not saying we're going to see people lined up to get a vaccine, but it does show that the opportunity to do something like this and to be a part of it and have a chance at possibly winning is something that appeals to people. It's human nature. We have evidence that it does. And so it seemed to me that it would be something that we should try, and that it would in fact increase the number, of people who are in fact getting it. So thank you very much. We'll close out this past month. 15 months have certainly been challenging. Kent State University, part of a project called the Global Vaccine Poem Project. It's helping Ohioans and others across the world express feelings about what the vaccine represents to them. So far, more than 1,600 people have contributed to the poem, either in person or online, representing every state in the United States and 89 countries around the world. And while the thoughts and words each person contributes are certainly unique and different, it is a project that is uniting people, healing, and is spreading hope. Let's take a look.
It's easy to participate online or by filling out a card, following one of four Twitter prompts. Inspired by young people's poet laureate, the LPC had 9. People can add their voices to our growing community poems every hour, every day.
Dear vaccine, let me close the distance. Let me hold my grandmother's hand and kiss the wrinkles on her knuckles.
We're getting closer to our Sunday gatherings and family cookouts, high fives, daps, and hugs. With you, dear vaccine, it grows easier by the day. I'm so glad I met you. If not for me, for them. What we need now is you, your voice, joining the ever-expanding global vaccine column. Help us reach our goal of 1 million responses. As we heal, we know that our way forward is possible together, arm by arm, voice by voice.
Well, you can join that as well. Thank you very much. Hope everybody has a good day.